Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo. How are you, doctor?
I'm very well, Luis. Thank you so much. How about you?
I'm doing great, as always.
Good.
We do have a very interesting topic today, which is stem cells for ulcerative colitis.
That's right.
In this case, doctor, what is ulcerative colitis?
Ulcerative colitis is an inflammatory bowel disease, along with Crohn's disease. Ulcerative colitis tends to be a little bit limited to the lower bowels. However, we can potentially see it in other parts of the bowels and even other organs. However, it tends to be localized to the large intestine, the colon, and the rectum. And ulcerative colitis is, we call it inflammatory bowel disease, but it's also an autoimmune disease where the body does not recognize self from non-self. So it creates and mounts a response and antibodies and an immune response to the body's own cells, okay? And so that's why we call it auto being self. And so autoimmune condition, just like the rheumatoid arthritis, Crohn's disease, multiple sclerosis, Parkinson's disease, there's diabetes type 1, all of these are considered autoimmune diseases as well.
Can we say that ulcerative colitis and Crohn's disease is the same thing, or is there a difference?
It's similar. It's very similar. The antibodies do tend to attack the inner lining of the intestine. So in Crohn's disease, it tends to be the upper bowels. So it could be the stomach, the small intestine, and so on. And then the lower bowels are usually considered the ulcerative colitis. So the large intestine, colon, and rectum. But very, very similar in their picture.
I see. Doctor, what are the symptoms that people should be aware in this case for ulcerative colitis?
Yes, some of the most severe and daunting symptoms tend to be bleeding in the bowels, in the bowel movement. There tend to be bleeding as well as pus, pain and cramping, sometimes fever, inability to tolerate foods. Those are usually the symptoms that we see with ulcerative colitis. We tend to also see other symptoms such as fatigue due to heavy bleeding from the bowels. And so we see fatigue and low iron. We see diarrhea. Diarrhea is a really big symptom, as well as failure to grow and thrive in children. Urgency to defecate, sometimes even during that urgency, inability to defecate. And those are the typical symptoms that we see with ulcerative colitis.
So it seems like we talk about inflammation here, doctor. As a result, people will have an autoimmune disease.
Absolutely. So as the name describes, so ulcerative colitis, the ulcers lead to inflammation, and because we have that breakdown of the lining, we see a lot of inflammation, really high C-reactive protein markers, really high erythrocyte sedimentation rate. We see a lot of cytokines that are released, and that's one of the reasons why there's so much pain. There's so much, bleeding. All of the symptoms are related to the inflammation. Correct.
So the stem cell treatment will be like an anti-inflammatory treatment, doctor?
Yes, that's part of it. So in our goal with ulcerative colitis and with any autoimmune condition, we have to do two things. And there are two parts to it that we have to address. And if we don't do it correctly, we're not succeeding as best as we can. So the first part is to halt the autoimmunity. So stop the antibodies from attacking itself, the body itself. Number one. Number two, we want to regenerate the damage that's already been done. And hence, like you said, we want to stop the inflammation and address the inflammation, which the stem cells do directly, as well as regenerate the cells of the intestinal lining so that we can repair those ulcers. And along with other factors that we need to incorporate, like diet, lifestyle, soluble fibers, natural anti inflammatories, probiotics, omega 3s. So there are so many factors that we want to incorporate in healing with the stem cells. So, just like you said, Louise, we want to address the inflammation, we want to address the regeneration, and we want to address the autoimmunity. So it's a multifaceted approach, and we can't neglect either one of them.
Since you mentioned the approach, what will be the approach in this case as far as the deployment of the stem cells?
Yes. What we tend to do with autoimmune conditions is it's really, really important that we apply the stem cells. It's an autoimmune. So this is basically what we want to accomplish is to, we want to allow for immunomodulation of the body. And so the stem cells allow for immunomodulation in terms of sort of changing the immune environment in the cells and to basically quelch the autoimmunity, quelch those antibodies. And we do that by applying the stem cells into the inguinal lymph nodes. And why the inguinal lymph nodes? What we want to address in the inguinal lymph nodes is, first of all, the lymph nodes and the whole lymphatic system is what's responsible for the immune system. Okay, and so the lymph nodes are little nodes, the oval shaped nodes that create the immune cells. So the B cells, the T cells, the natural killer cells, and so in that whole system with the lymphatic vessels, the lymph nodes, the whole bone marrow, we inject the stem cells into the inguinal lymph nodes in order to allow for that immunomodulation, okay, and with the inflammation. So that's number one. And then number two, we will apply the stem cells also intravenously, so everywhere the blood flows as well, so that we get a total body effect and the stem cells go to the bowels themselves, the large intestine, the rectum, and then anywhere else there may be damage and inflammation due to the antibodies and the autoimmunity. So we address it very, very functionally and very comprehensively.
So, doctor, why is so important in this case this comprehensive treatment that you do?
Yes, well, it's important in every case, for pretty much, but in this
Okay.
case in particular, thank you, Louise. In this case in particular, with autoimmune condition and ulcerative colitis, it can be very delicate because a lot of patients are limited as to what they can eat, how they react to the foods, and just a big lifestyle. It can be a big lifestyle change. So it's really important that we do the detoxification, and with that detoxification, we use the glutathione and NAD, which really helps with energy production in the mitochondria, as well as detoxification at the cellular level, antioxidants and detoxification at the liver, and so on. And this really is really important with ulcerative colitis and with autoimmune condition, because there tends to be, with all the inflammation, the derivatives of the cellular metabolism that doesn't get necessarily cleared out as well as it could be. So the detoxification process is really important. And then diet is super important, and incorporating soluble fibers, and at certain key times of the day, It's really important that we are incorporating this at key moments, as well as the anti-inflammatory effects of omega-3s, certain key herbs and minerals, as well the soluble fiber that I've mentioned more than once here, and again at key moments of the day. And also the oxygen therapy, which again is so reparative in the whole system, not just the gut. And then in age-related and age-appropriate growth hormone therapy, which helps the stem cells again, helps the body as a whole, and of course the whole psychological aspect of healing, which we never neglect in addressing as well.
So now, doctor, in case some of our listeners want to get in touch with you, what would be the step-by-step procedure here?
Mm-hmm. Really, thank you for that, Louise. A lot of listeners and viewers, they don't know how to get in touch with us, or they don't know what the next step is in just obtaining information. Basically, they can reach out to us by email at info@stemcellhealinginstitute.com. They can contact us through one of our social media portals. Is that correct? We have the Instagram, we have the Facebook, we have YouTube.
We even have TikToks.
That's right, and TikTok, and then you can call us up directly. We have we have a couple of phone numbers, our Central American number, as well as our U.S. number, which is I'm sure that Louise will provide that for you at the end of the podcast.
That's right. By the end of this podcast, you will find all the information how to contact Dr. Figueredo. And I don't know if I missed anything, doctor. Maybe you want to say something else here?
I think we've covered a lot of ground, and we welcome any specific questions. A lot of our viewers and listeners send us specific questions, and we're happy to address them. It's always easier for us to receive the questions. We can respond in a direct manner, usually by telephone or email, so that any questions beyond what has already been asked can be answered in a very comprehensive manner. So it's always we always welcome direct contact with us, so that we can address each individual situation case by case.
Also, if you're wondering if stem cells can work for you, you may send us a question regarding your condition. So maybe we can make a video about that. Doctor, I appreciate your time, and I wish you a wonderful afternoon.
Thank you, Luis. You as well.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.